Patients with peripheral vascular disease may begin with mild symptoms or actually go straight to severe symptoms. So some mild symptoms that are associated with peripheral vascular disease is something called claudication, which means pain in the back of the calf when walking. In general, when you're not walking, you're not stressing the blood vessels. You don't need as much blood flow. So if you're just sitting around, you need a very small amount of blood flow to the legs to maintain consistency. But when you're walking, you're exercising, you need a lot more blood flow to the legs. And if you have a blockage in the blood vessel, you can't get that extra blood flow that you need into the legs, and therefore your body will develop pain because it needs the blood flow, it needs the oxygen to feel normal. And therefore the first sign may be claudication. You may start walking a block or 2 blocks and start developing pain in the back of the calf, which makes you have to stop and rest. That's one of the earliest signs of claudication. A more significant, later sign of peripheral vascular disease is something called rest pain. So normally you shouldn't have any pain within your feet or your toes at rest, but sometimes when you're not getting enough blood flow, you may get severe pain, coolness, numbness in the toe, and even when you're lying down, it's hurting and may require you to shake the toe, rub the toe, or even have to sit up to have gravity help you get some blood flow down to that foot. So that's a little bit of a later sign for peripheral vascular disease. More severe stages, patients who have developed a small wound. So we know diabetics are at risk of developing severe infections, even just with minor injuries. They may cut the toes wrong and get a small wound, and that can, within a couple of days, can develop into a very severe infection. So poor wound healing, particularly in the extremities, is another sign. And lastly, obviously, gangrene, which is when a toe or a foot turns black. That's the latest sign, and that's indicative that the limb or that organ is dead and has to be removed.